We hear of a very common problem, which is referred to as cervical or lumbar spondylosis. This term refers to the changes that we see, A, because of overuse of the spine, and B, because of advancing age. These changes that occur are generally starting in what we call as the discs. The discs are shock absorbers between each vertebra. The vertebra, one on top of the other, makes up what is the spine, and between each vertebra, you find a disc, which is a shock absorber, because of which we are able to twist, turn, and bend. Now, when degeneration occurs, there are changes in the disc. On the MRI, this disc can appear to be a little dark, lose a little bit of height, bulge behind, which in some instances can narrow the space for the nerves. As a consequence of this, there could be thickening of the ligament that we see within the spine. There could be overgrowth of bone, which we call as osteophytes. And there could be changes of spondylosis in the facet joints of the spine, which are in the back. And because of all these reasons, there could be pressure on the nerves which lie within the spine, either the central part of the nerve or the branches that come out from the nerve root canals. Now, depending upon the pressure, there will be symptoms, either radiating pain into the arms in case of the cervical spine, or radiating pain into the legs in case of the lumbar spine if the nerves are being compressed. If, on the other hand, it's only facetal hypertrophy or the discal pain, there will be a grumbling low back pain. Most of these are addressed by regular exercises and a change in lifestyle. In the event these are not addressed by exercises alone, then one could consider giving injections in and around the nerves, around the facet joints, so that the pain is reduced. And these injections constitute local anesthetics and steroids. In the rare instances, one would have to consider surgery, either decompression or decompression and fusion, and in some instances, disc replacement.
Subscribe to our YouTube channel and press the bell icon to get the latest healthcare updates.